Hello everyone, welcome to Medicus Aeternus, where the journey to mastering medicine never ends. We are here to make learning easier, more enjoyable, and to help you excel in your medical path. So let's dive in and learn something new today. Today our lesson will be about reactivity and resistance, which shows that the same storm but has different battles, and it also indicates that biology doesn't treat everyone equally. This lesson is part of our general pathology playlist, so be sure to explore the other topics as well, and if this is your first time watching our videos, we would love to have you join us. Please hit that subscribe button and let's begin. In this video we will speak about reactivity and resistance as we stated before, and it shows that scientists have discovered that the same disease can affect different people in surprisingly different ways. This lesson is also has a connection with the previous lesson, general adaptation syndrome. You will find the link here and above in the corner, and also you need to check that video again. So the same storm hitting each person, but it has its unique force. Now we'll speak about reactivity. Reactivity from the Latin language means the reaction, the opposition. So it is the ability of an organism to respond to any environmental influence by changing its life activity. And also some Russian scientists, here we have Nikolai Nikolaevich Serotonin and also Andrei Dmitrovich Ado. They have their own definition for reactivity, which shows that how it reflects the whole organism and its reaction to the external factors. So here, as Nikolai Nikolaevich said, that reactivity is a property of an organism to respond definitely to action of environmental factors. And what said Andrei Dmitrovich, that reactivity is an property of any organism as a whole to respond to the surrounding by changing his ability to live. These all definitions, they measure the speed, the intensity, and the duration of the response. Here we have also the forms of reactivity. We have the normergy, the hyperergy, the hypoergy, the anergy, and the dysergy. In the normergy, it shows the normal reaction of the body, which is the adequate response to any external factors. So for example, if there is heat, the body will try to sweat to make you cooler. If the temperature is cold, the muscles will twitch and make some contractions to make you feel hot. The hyperergy is an increased reaction, while the hypoergy is a decreased reaction. You can see this in morbidly ill people who have, for example, diabetes or any chronic diseases. When they have inflammation, their body will not respond to that inflammation properly. So they will have either hyperergy or hyperergy. The anergy, it means there is no reaction to the stimuli, and the dysergy means there is an adequate response. For example, if you let a light on the eye of someone and there is no reaction of his pupil, that means he has anergy. But if he has this ergy, that means his pupil will not constrict, it will dilate, that means it's dysergy. Here we will talk about the types of reactivity. We have the species reactivity, the group reactivity, and the individual reactivity. Description of each one. Here, for the species reactivity, we have the reactivity that is typical of a particular species, aimed at preserving the species through adaptive and protective responses. The examples here, the seasonal behaviors, hibernation, migration of birds and fish. Hibernation, for example, in bears, the polar bears. During the winter they hibernate, and then in summer they go outside and they search for food. The species specific defense mechanism. Some diseases, they don't affect some species. For example, here tetanus, it affects human beings, but in sharks it doesn't. They have resistance against tetanus. The reason for that, because the shark, they have a thick derma, thick skin, so the tetanus bacteria, it cannot go through their skin. The group reactivity, it is the reactivity of specific groups based on a common characteristics, age, sex, constitution, or any medical conditions that lead to collective responses aimed at group survival and adaptation. For example, here in different age groups or genders, where we can see different risk factors in one group while the other seems to be more resistant. For example, some diseases, they affect children more than elderly people and vice versa. Some affect men more than women. Cancer, they affect men more than women, but breast cancer affect women more than men. The constitution, body types, we will speak about them later. the ectomorphs and the mesomorphs, any medical conditions, for example, some patient who have diabetes or pregnant women. Here we can see that increase in the glucose level in diabetic patients has more severe complications than in healthy people, and also increase of the blood pressure is more devastating in pregnant ladies than in ladies who are not pregnant. And the complication of increase in the blood pressure in pregnant women, it can lead to preeclampsia, for example. The individual reactivity, it shows the reactivity of an individual organism to the external stimuli aimed at maintaining hemostasis, health, and the survival of this individual. We can see that influenza resistance. Some individuals are more resistant to influenza and they are carriers of the disease, of the virus, while others, they are highly vulnerable against the disease. Also, the tailored treatment, individualized treatment for patients based on their personal reactivity. This indicates that each person should be treated based on their personal reactivity, which means that the international classification of diseases and the guidelines of their treatment are based on the collective study of many cases that have been treated previously. However, one must bear in mind that some cases are unique and need more different types of management. Now we'll speak about the body constitution. As you may know, that constitution of human beings, they are either fat or slim or athletic, and this is what it means by the constitution, the body constitution. It's the complex of the morphological functional features of the body formed on the basis of the inherited and the acquired properties, and it determines the peculiarities of body reactions. We have here different types of constitution that was made by different scientists and doctors. Here we have the Chinese form by Sigu. In traditional Chinese medicine, refers to a specific, less common body constitution type related on the phlegm, the dampness. It's characterized by a tendency towards the accumulation of the pathogenic factors, oily skin, sticky discharge, feeling of heaviness and susceptibility to skin and urinary issues. It represents the imbalance where the body struggles to clear the waste, often seen in those with oily complications, acne, and sometimes obesity. And it's part of the Chinese medicine framework of the 9 main constitutions that guide the personalized health. They have the yin and the yang types, and it shows that the respiratory type, digestive type, the muscular type, and the brain type. Now we will speak about the Pavlov method. In the Pavlov method, it is based on the nervous system regulation. It shows that people are divided to 4 types: the choleric, which are the strong and impetuous individuals. They are quick to react. The phlegmatic, the strong, equilibrated, and quiet individuals. The sanguine shows the strong, equilibrated, lively, and social individuals. And the melancholic, the weak and the slow reacting, the introspective individuals. Now we will talk about the 3rd type of the body constitution, which were created by the German psychologist and pathologist Ernst Kretschmer. He linked the physical body types to the personality traits and the mental disorders, proposing 3 main types. They are the picnic, which has short, round, and stocky, fleshy built physique, and they are associated with these disorders by bipolar disorders, maniac, and depressive. The leptosomatic, which are the slender, thin, and who they have the long limbs, and they are associated with schizophrenia. The 3rd type are the athletic type, who have the muscular physique. They are strong with broad shoulders, and they are associated with the energetic, irritable, and they have the potential to develop epilepsy. The 4th type of body constitution is formed by Hippocrates, and this is one of the oldest classification of body types. It is based on the humors, the fluids in the body. Hippocrates viewed the body constitution through the humorism, believing that health depends on balancing the 4 vital fluids: blood, phlegm, yellow bile, and black bile, leading to the famous 4 temperaments: sanguine, phlegmatic, choleric, and melancholic. We can see here the similarities between the Hippocrates classification and the Pavlov classification, and he also emphasized that the person's constitution also involved lifestyle, diet, exercise, sleep, environment, age, and sex, and all these factors. Now about these types. The sanguine, which shows the person who has more constitution of blood, and this person is more sociable, more pleasure seeking. The choleric shows the person who has more yellow bile. This person is more ambitious and leader-like. Phlegmatic is the person who is more in phlegm. He is calm, thoughtful, and relaxed. And the melancholic, the person who has more black bile. He is more analytical and serious. The fifth and the most important body constitution classification is by Chernotsky, and this classification is used in medicine. This classification is of three types: the asthenic type, the individuals with long extremities and the narrow thorax; the normosthenic, individuals with the proportional constitution, wide chest, well-developed muscles; and the hypersthenic, individuals with the short extremities, short neck, and the wide thorax. And you can see them here in the picture. This is the asthenic, the normosthenic, and the hypersthenic. To find out about these three body constitution, we use these two measurements. The first one is the index of Pine. We measure the growth in centimeter, the height, divided by the chest circumference in centimeters, and we add the weight in kilograms. If the values are between 10 and 30, this person is normosthenic. If it is more than 30, he is asthenic, and if he is less than 10, then it is hypersthenic. The other measurement, we use the epigastric angle. We put the hand here between in the chest, and we put the thumbs in the angle of the ribs here. We measure them, and we find out if the angle is less than 90, then this person is asthenic. If it is approximately 90 degrees, then he is normosthenic, and if it is more than 90, it is hypersthenic. Now, why we need all these types of constitution? Why we need to measure all these types and find out why this person is asthenic or normosthenic or hypersthenic? Well, it was found out that these three types of constitution, they have more tendencies to some diseases. Here in the asthenic, the tendency to ptosis of the organs, for example, the nephroptosis, when the kidney drops down, the stomach ulcer, arterial hypotension, anemia, and hypoglycemia because of the decrease in body fat. The normosthenic, they have predisposition to diseases of the upper respiratory tract and musculoskeletal system. And the hypersthenic, they have the tendency to hyperlipidemia, hyperglycemia, predisposition to diseases of the cardiovascular system, atherosclerosis, myocardial infarction, hypertension, diabetes mellitus, because of the increase in body fat. And to find out about them, we have here the functions, about the body functions, and the asthenic and hypersthenic types. In arterial blood pressure, we find out that in the asthenic people, they have decrease in blood pressure, while in the hypersthenic, it is more. Vital lung capacity here in asthenic is more, but in hypersthenic is decreased. Secretion and motility of the stomach in asthenic is increased. That's why they have stomach ulcer, while in the hypersthenic it's decreased. Metabolic intensity in asthenic, they are highly metabolic, while in the hypersthenic it is decreased. Function of the thyroid gland, it is increased in asthenic, while it is decreased in hypersthenic. Functions of the adrenal glands, it's decreased in asthenic, while it is increased in hypersthenic. Blood level of glucose and cholesterol is decreased in asthenic, while increased in hypersthenic. And the function of the sexual glands increased in asthenic and decreased in hypersthenic. We use all these functions and understand the body constitution to know which diseases are more prone, which constitution is more prone to which diseases, and vice versa, like this. Here we will discuss about the role of age in pediatrics, children, and in geriatrics, the elderly, more than 75 years old. We found out that in pediatrics, children, they have immature nervous and endocrine system due to the incomplete differentiation. This will lead to decrease in the pain sensitivity. This will also lead to the increase in the systemic reactions, decrease in the adaptive capacity, and decrease in the urgent adaptation mechanisms. They also have immature immune system, which will lead to the increased susceptibility to infections. They have high permeability of barriers. Generalization of infection is very easy in children. That's why of the diminished pain sensitivity, the high skin permeability, and the no passive protection for children, they are hyperergic in the type of reactivity. While here in the role in the geriatrics, the elderly, we have here the neuroendocrine regulation impairment. They have decreased activity of organs due to age, poor expressed symptoms, increase in the chronic diseases. They have comorbidities adaptation fatigue, their immune system is insufficient, they have decrease in the systemic reaction expression, increase in the susceptibility of infections and in the frequency of neoplasms, and because of this they are more hypoergic. Now I'll explain more about the 6 factors and how males and females have different predisposition to different diseases. The XX chromosome, which determines the female traits, including the morphological and the functional features. In here we see that the male embryos are more likely to die prenatally than the female ones, and as we know that genetic diseases which are carried by the 6 chromosomes are more on the X chromosome, and while females they have 2 X chromosomes, that means the probability of their showing up it's less than in males, while males who have just 1 X chromosome, if they have any dysfunction in one of the genes, they will have the disease more often than in females. Females maybe will be carrier only, but males they will be either sick or healthy. Women live longer than men, also we can say due to this. Better integration between the hemispheres of female brain, the right and the left hemisphere. Women lose the ability to speak due to brain insults less frequently due to the enhanced integration between the hemispheres. Larger brain region responsible for emotions are 8 times larger than in men. That's why female they express emotions and they understand emotions more clearer than men. They have more emotional and they're prone to depression because of their emotional intelligence. The monthly menstrual cycles makes women more resistant to blood loss. That's why if a woman has like any hemorrhage or anything, she will not be that much prone to anemia more than men. Hormonal fluctuations due to pregnancy, lactation, and menstrual cycles. That's the problem here. Disease of the endocrine system are 10 times more frequent in women because of their hormonal fluctuations. Women are more prone to iron deficiency anemia due to hemorrhage in the menstrual cycles. They have high resistance to hypoxia, cold, starvation, and blood loss because they are used to bleeding in the menstrual cycles. They have better adaptation to stressors due to hypothalamus, pituitary, adrenal system training. Here we'll speak more about the male individuals who have the XY chromosome that determines the male traits, including the morphological and the functional characteristics. We can see that men excel in speed of movement and coordination than female. They have more mathematically mentality. Their left hemisphere is more developed than the right hemisphere. Men are less resistant to stressors because you know that female they have more emotional intelligence than men. That's why men they just focus on the problem and deal with it without any emotional distinction. Disease of adaptation are more common in men, for example atherosclerosis, and also cancer diseases. Now we are halfway through the video. If you found the information here useful, subscribe to the channel, hit that bell for updates, and show some love by liking and sharing this video with your friends. Now let's continue in our subject. We have here the role of the nervous system in reactivity. We have here the nervous system conditions and the impact on the body. The exhaustion of the higher nervous system activity will cause the reduction of reactivity to chemical poisons, bacterial toxins, and antigens. Influence on the limbic system will cause disruption of behavior, reactivity, and the conditioned reflex activity. They will lead to the psychological disorders. Bilateral damage to the hypothalamus will affect sleep, sex drive, hunger, thirst, and other reactivity manifestations. Parasympathetic nervous system excitation will increase the antibody production, enhance the antitoxic and the barrier functions of the liver and the lymph nodes. Sympathetic nervous system excitation will release the catecholamines, stimulate the phagocytosis, increase metabolism, and heighten the reactivity. Any damage to the spinal cord will cause decrease in resistance to infections, will cause inhibition of antibody production, will reduce metabolism and lower body temperature. Damage to any peripheral nerve will cause the formation of ulcers in the stomach, intestines, eyes, and also hemorrhage in lungs. Now we'll find out the difference between the physiological reactivity and the pathological reactivity. The idea of reactivity is useful for human beings, for any creature. But the thing is, the physiological reactivity is the useful one because it is the reactivity of any healthy individual, any healthy organism to adequate environmental stimuli without disturbing the hemostasis. Example for this is the thermoregulation. Thermoregulation, for example, if the weather is cold, you will wear clothes, yeah, your muscles will start to contract to make you feel warmer. But if the weather is hot, your body will start sweating to make you feel colder. But here the pathological reactivity, it's the reactivity of the body to the extreme environmental stimuli, aiming to restore homeostasis and save life. For example, here the disturbance of homeostasis, increase of blood pressure or decrease of blood pressure, increase of glucose level or decrease of glucose level. In this case, the body will try to regain its normal values, its normal levels. But if this stimuli is very extreme, the body will find it difficult to return to normal way, and in this case the reactivity here will be pathological. The specific reactivity and the non-specific reactivity. The specific reactivity is the response to a specific factor, usually an antigen, that involves antibody production or cell reaction. Examples here: the normal way, antibodies match the antigens, and here the abnormal way is the autoimmune process cause self-damage. The non-specific reactivity is non-specific, is related to many factors. All changes in the body occurring in response to the influence of the external agents and not associated with the immune reaction are the signs of non-specific reactivity. Here the example is hypovolemic or traumatic shock. In a simple way to describe them, specific reactivity is the same as the local inflammation, that the body will try to fight this inflammation locally, while the non-specific reactivity is the same as the systemic, the general inflammation, which will cause the inflammation of the whole body. All the systems will get affected by this inflammation. The infectious allergies, autoimmune disease, they are involved in both specific and non-specific, because at first they will cause local inflammation, specific reactivity, but then they will develop to non-specific reactivity, to the systemic inflammation. Now we'll speak more about the term resistance. Resistance is the ability of our body to save stable state against the action of pathogens. So it shows how our body protects us, how we protect ourselves. We have here the forms of resistance: primary resistance, secondary, active, and passive. In the active, which use energy, here the body will produce antibodies against the antigens, the phagocytosis at the inflammation site, neutralization of poisons, erythropoiesis in case of hypoxia, and in vaccination. The passive way is provided by the barrier systems: skin, mucous membrane, skeleton, hydrochloric acid in the stomach, lysozyme in the saliva. About the primary and the secondary resistance, the primary one is hereditary. It's based on the morphofunctional specifics of the body, owing to which an organism is resistant to the action of extreme factors. Unicellular organisms and worms are resistant to radiation, cold-blooded animals to hypothermia, and etc. Due to the hereditary immunity, people are not subjected to many infections typical of animals, and in the period of epidemics of smallpox and plague, some people who were directly in contact with sick people didn't catch the infection. Hereditary resistance immunity in particular, gonorrhea is a human disease. Animals cannot be infected with gonococcus bacteria. It's possible to infect hens with anthrax only by exposing them to cold. However, they are resistant to it in ordinary conditions. The secondary form of resistance here is the acquired. For example, the immunity develops after some infectious disease after the administration of vaccines and sera. Here we have the resistance to non-infectious agents. Non-infectious interventions can be acquired through exercising, resistance to physical exertion, to acceleration and overstrain, hypoxia, low and high temperatures. Now we reach the end of our video of reactivity and resistance. Also check out the other videos about introduction to pathology and general adaptation syndrome to have the whole idea of pathophysiology and pathoanatomy. Thank you guys for watching Medicus Aeternus. Remember, the journey of medical professional is eternal, and we are here to guide you every step of the way. Don't forget to subscribe, hit that bell for updates, and show some love by liking and sharing this video with your friends. Stay awesome, keep learning and thriving.